Hi guys, welcome back to my channel. In this video, I wanted to talk about what to expect when you visit a psychiatrist in India. I fully understand that it can be anxiety provoking to visit a psychiatrist in India. Things have gotten a lot better. Of course, there is a lot more mental health awareness of late, and it's a lot less stigmatizing to visit a psychiatrist. If you're stressed about your first visit and you're curious on what could possibly happen in your first visit, then this video is for you. One of the things to remember is India is a very diverse country. We have several different kinds of healthcare systems at place. We have the state government institutes, the central government institutes, and along with that there's corporate, there's private hospitals, there's also private practice. So because of this, there could be some variability in terms of your experience while you're seeking care. So the first step is registration. So you'll come to the hospital, you'll register yourself. If you're visiting the hospital for the first time, then you would have to make a new registration. So you will fill in your details. Details would include things like your name, age, your address, contact information, emergency contacts, things like that. Then once you've registered in, you'll go to the psychiatry department. There'll be a reception there. You'll show the details of your registration to the receptionist and they'll take you to the waiting area. Your waiting time depends on one or two things. Firstly, have you made an appointment? So did you make a prior appointment for seeing the doctor at a particular time? Or had you come to the hospital and were hoping to meet the doctor on a particular day without an appointment? Because let's say you have made an appointment, then the waiting time may be shorter. But if you've not made an appointment, then the waiting time may be a little more. Let's say you're waiting and your appointment time approaches. And at that time, there is a patient on a stretcher or there's an emergency patient, then doctors are supposed to triage and see the emergency or the stretcher patient before you. So that can also add plus or minus 30 minutes or 1 hour to your waiting times. The next step is depending upon whether you go to a teaching institute or whether you go to a hospital where there are no students or no trainees, right? So if you're going to a teaching institute, then usually a resident or a psychology student will collect your information. What are the things that they'll ask you? History taking in psychiatry, broadly speaking, the headings are very similar to any other history taking in physical illnesses. So the first things will be your information like what are your name, age, gender, where are you from, who all are there in your family, just some general background information. And once that is covered, they'll ask you specific questions about what brings you here today and more in detail about what seems to be the problem. A few questions that they may ask, which may make you feel uncomfortable, but psychiatrists generally have to ask is, one thing is about substance use. Do you have any alcohol use, tobacco use, cannabis use, anything like that? Another thing that they have to ask about is suicide risk. So whether you have suicidal ideations, whether you have had attempts. They'll also review any old treatment records. Now you might have had a physical illness for which you've taken treatment. So many people may be on treatment for different illnesses like diabetes, hypothyroidism, hypertension. So then they'll ask you about that, how long you've been on treatment for that. And they'll also note down the treatment records. One thing that I've noticed that you could do to make the visit more efficient is if you can bring in details of your physical illnesses and any medication that you're on, as well as any investigations that you've done. So a lot of times what happens is that psychiatric illnesses also have physical causes. So we need to do some blood investigations to identify those causes. So suppose if you've already done blood tests and you've already done these investigations by meeting a doctor elsewhere or meeting your physician, then if you have those reports, then I don't need to repeat it again. And that could save time in terms of evaluating the cause as well as proceeding to the treatment more quickly. Once that is collected, they'll also ask you things about your family history. This could include things like, does anybody in your family have a medical illness? Does anyone have a psychiatric illness? Are they on any treatment? One of the things that's observed in certain mental disorders is that treatment which is effective for, let's say, another family member, especially if it's like your parents or a first degree family member, that can be effective for you as well. So that information could be really useful. They'll also ask you a little bit about your childhood, your past. History taking in psychiatry does take a little more time than for physical illnesses. So it does help if you block out about 1.5 hours at least for your first visit. Now that also may not be enough sometimes. And so then they'll give you an appointment for what we call as a detailed evaluation or a detailed workup. And that may take at least 2.5 hours on the whole. After these 2 sessions, after your first and second session, once the doctor feels like they have enough information to move forward, subsequent follow-ups may not be very long. It may be around 20 to 30 minutes. And it also depends on whether your doctor is also doing a therapy and if you have a psychologist as well. Towards the end of your history taking, your physical examination and your mental status examination, they'll discuss various treatment options with you. Now, one of the common myths in psychiatry is that psychiatrists immediately give medications and, they don't discuss about other options like exercise and therapy, and which is not true. So they will tell you what are your different treatment options. They'll tell you the risks. They'll tell you the benefits of all the different treatment options. And based on that, you can discuss with your doctor what you think is best for you and then decide on how you want to proceed. Now, at the end of this discussion, it may be possible that you're still not sure and you're ambivalent about your treatment options. Then for you, the right thing could be that you want to take some time and you want to think about it and then get back. That's also okay. And towards the end of the session, if you feel like you're not comfortable with your psychiatrist, or if you feel like the rapport is not very good, then you can also change your psychiatrist. Remember that sometimes the first psychiatrist is not the best psychiatrist for you. It's important to feel very comfortable and have a good rapport to discuss personal information and details regarding mental health concerns. So in case you're not comfortable and you feel that this is not the best fit, most psychiatrists will accommodate for that. You can tell them and they'll change the psychiatrist, or you could just request at the reception and they'll change it for you. It is possible that sometimes the psychiatrist will ask for either a friend or a family to come for the next visit. This could be because they want more information about, let's say, your childhood, which you don't remember, or it could also be about discussing important things like a safety plan in the case of suicidal ideas and so on. Thank you very much. I hope you found this video enjoyable. Have a nice day. Bye-bye.